In Colorado, we're definitely facing a prescription opioid problem.
A few years ago, the White House drug czar, Gil Kerlikowske, issued a white paper statement considering it an epidemic.
And so we've known it's an issue, but it's really been just a very small number of people that have really known that it's a very large-scale issue.
It's really important to promote and reinforce the role that providers play. They're the individuals that a patient is looking up to provide them with safe and good medical care. They're looking to that provider to give them the information that they need around the medications that they might be taking.
We do procedures that sometimes do cause discomfort or pain for our patients. We want to make sure that they're covered with adequate pain medication, but the stress is on adequate.
Doctors and pharmacists and dentists and nurses all know about pain, but most of them would probably tell you they didn't receive a lot of training in identifying pain, diagnosing pain, all different sorts of modalities for treating pain.
There needs to be more frequent exposure to basically opioid-related issues.
I think it's really, really important that the provider is talking about how to safely use these medications and why. A lot of individuals don't understand the importance of keeping their medications locked and reducing access in the home for anybody that may be entering the home or that lives in the home.
We have to be very careful when we use these drugs. Not that we can't do it, but we need extreme caution in doing it. We need to be able to monitor you. We need to continue to see how these things are working, and if they're functionally continuing to help you improve, great. If they're not, we may need to consider other alternative modalities for treatment.
I think one really big tool that we have at our disposal is actually the prescription drug monitoring program. I would highly recommend that all prescribers sign up for the PDMP or prescription drug monitoring program. This is essentially a large database where prescribers will enter information about new prescriptions, and you can also identify if a patient actually is receiving medications from multiple providers.
The PDMP is an amazing tool.
It's the one single source for finding what is being dispensed by whom and where.
Really gives us an accurate scope of what the patients are taking.
I think that this is something that we as a nation and especially as prescribers need to step up to and address now.
There's studies that show that conversation around substance abuse from a healthcare provider is very, very useful. This work will save lives.
I think people should, and physicians and providers especially, have a role as trusted professionals to have a leadership and a public health obligation to become more involved in their own professional associations and do something. Do one more thing to help the problem.